Well, I'm always a skeptic, so, you know, I like to get a little firsthand information. So I think we do have some people here today that have had some success with tapping. So let's go out there and see if we can talk to some people, okay? Hi, how you doing?
Good, how are you?
Good. What's your name?
Jerry Deegan.
Jerry Deegan. And what do you got there?
I'm hiding something. I think this is for you.
Oh, awesome. Look at this.
Perfect.
How do I look, yeah? Young man, there's a place. Actually, there is no fireman in the Village People. But anyway, what's the significance of this helmet?
It's quite interesting. 2007, I was forced out of the workplace as a firefighter due to post-traumatic stress disorder. And for about a 5-year period, that was buried. Couldn't find it. Literally hid it somewhere in the house, couldn't find it. Basically, PTSD, shamed, a whole bunch of issues. And of course, in 2011 and in 2012, discovered emotional freedom technique, and several practitioners worked on me and did a phenomenal job. There were actually 3 events that sort of were the, if you want to look at it, the crowning touch that kind of pushed me over the edge. I can smile about it now, I couldn't smile about it then. And most of them involved children, which is obviously the worst.
Mm-hmm. And because you had such success with it, now you're a practitioner yourself, you're teaching others?
That's correct. I've worked on a little over 100 people to this point, firefighters, nurses, police officers, and military people. And amazing to see it from the other side of the chair and watch the transformation. How quickly it happens, how easily it happens. It's painless. To someone that doesn't understand tapping, it's almost magical. And at first, you know, they think, well, what kind of drugs is this guy on? I need to try some, right? Yeah. It seems to be working for him, but wonder why it's working for him. What is it all about? Right. What this does more than anything is when you see morbid events, when you experience them, smell them, hear them, you have the ability to take that down a number of notches to the point where you no longer, it no longer becomes all of the things that a trauma is. You remember it, but you're not triggered. It's not an emotional event.
My experience with tapping was pretty huge. The biggest thing I think that happened was I was diagnosed with clinical depression when I was 19. And I spent several years on lots of different medications and told that I would never ever be off of them. I interned for Karin Davidson in a different business entirely as a graphic designer. Oh. And I had sort of a little breakdown in her office and was trying to like sit at my desk and not cry and not let anybody in the office see me cry. And she was like, "What, are you crying? What are you doing? Come here." And she was like, "I'm gonna do this thing on you and it's weird, and just deal with it and I'll explain it afterward."
I love she prefaced it with, "This is weird."
And I was like, okay, and it worked. Yeah. And it was crazy. And then I spent a lot of time working on it, and now I'm off medication. I haven't had any relapses in 5 or 6 years. I was an artist before I was diagnosed with depression, and then because of all the meds, I wasn't able to see pictures in my mind anymore. And through some tapping specifically on that and the side effects of the meds, I see pictures now again. I'm now an artist. I've finished 2 degrees since not being depressed when I couldn't even go to school when I was.
I'm an EFT practitioner, and I found Karin as I was looking for a way to clear stuff that I had, that I had for years. I had some issues in my, some memories that kept popping up. And no matter what I did, I was a performer. And no matter what I did, my conscious brain would say, okay, so I know the problems in the past and it's done with, and I know it's not with me now, but it would still be there. And no matter what I did in my conscious mind, I couldn't change it. I performed very successfully, but I had a problem with going further, being even more successful. And so over the years, I kind of left show business, and then I had a family, I had kids, and then I wanted to come back into showbiz. And I found that when I went to audition, I would come up with the same terror. It was terror. And I didn't realize at the time that I was actually having post-traumatic stress. My issue was incest. Wow. And sexual abuse from when I was a kid. And I thought I had it handled, but I really didn't. So that's when I started, working on that issue. EFT has helped me realize that and get through the trauma. Once you get through the trauma with the EFT, with the tapping, and you work on the multi-levels like an onion skin, you're peeling the layers off the onion. In my experience, I was trying to hide. So when I was performing, I wasn't really being as really awesome as I could have been, because there was this part of me that was, contracting in and hiding. Because I didn't want people to really know the truth, which was my belief system, which was I'm not good enough, or you really can't know that about me because it's hidden and it's dirty and it's all these things. So there we go. But EFT helps. My God, it's fantastic. So now I'm a practitioner and I help others with that issue. So
good for you.
I've actually had so many amazing breakthroughs with tapping, but I think we wanted to focus on a couple that I had when I did the EFT practitioner training.
Okay.
And I've had chronic pain my entire life, and also a traumatic brain injury when I was around 40. I was really being bothered by the lights in the room where we had our training. The reason that they were hurting me is because when I was in the ambulance, it had that same kind of light.
Ambulance after you had
this accident, yeah.
Okay.
And I had been for 13 years unable to be in fluorescent lights for more than a little tiny bit of time. I would have seizures. And I don't know, maybe about 6 months ago, I started every time I was hearing people's problems, I would say, I think I could help them with tapping. So I decided to take the EFT practitioner training with Karin.
Do people notice the change in you?
Oh my God.
Obviously you can drive at night now, that kind of stuff. But
So incredible changes. My friends don't even recognize me.
All through my teenage years, early 20s, I had suffered from depression on and off. Never really wanted to take the medication route. I had found Reiki, which is kind of like pot to me. It's like the gateway into this energy world, gateway into a new type of drug.
Wait, did you just say pot?
I did say pot. It's what it is. It's the gateway drug, right? So
it is.
EFT was my next step. It was my next drug. I didn't know what it was. I just saw the sign, hey, EFT group, $10, and I walked in. And I walked out a whole new person. And so I kept going back. It was a group session, $10, I could afford that. And I was doing my own work without even realizing it. So I tapped for the next 4 years. But I always thought I had to sit down, get ready, do all of these points and know what I was gonna tap on. And then after reading Karin's level 1 and level 2 books, I realized I could incorporate this in a whole new way. And at that time I had just become a mom. And I'm a mom to a beautiful, funny, just amazing son, but he's not a sleeper. And so I started tapping on him for saying, I couldn't communicate with him, he couldn't communicate with me. But as I would hold him, I would just gently rub on his points and say, even though I don't know why you can't sleep, I know you're having trouble sleeping, and it's okay. And he would fall asleep in my arms. And it was amazing for something that had brought so much frustration to me to have a way to just be able to, in a few minutes, calm both him and me. And so I think every parent should know tapping, because I use it now not just for sleep. This morning he bumped his head, he started crying, and he now knows. I go, do you want to tap? And he goes, tap, tap, tap. And so we just tap on the spots to let it release. So their kids are gonna have all these little traumas. If I can help him learn how to take care of the little traumas, when he has a big trauma, he's already prepared. If everyone learned to tap and then everyone showed someone else how to tap, we'd raise an amazing group of young children.
Yeah. Well put. Well, thank you so much, Steph.
Thank you.
All right.
Beautiful stories.
Really moving stories.
That's
seriously.
what it is.
And a whole range of things.
That shows you the
Abuse.
gamut.
Really,
it shows you the gamut, what it can help.
Right.
It makes you feel better, but it also does all those
Post-traumatic
things.
stress. It's phenomenal.